Thank you, John. Thank all of you. And Don, I enjoyed hearing your presentation. And I just want to concur with what John said, that this debate is not limited to health care. All of you in this room know it, and I think the American people are coming to know it rapidly. Don, I appreciate your comments about the wedge, because that is so important. I'm going to be like Don. I'm going to try to be brief, and then hopefully if there's time for any questions, we can answer what you want to hear instead of what we want to tell you. But want to start off with just some parameters. As we move back, I'll leave here, I'll head to D.C. tonight. We will tee this bill up probably, and it's sitting in really three different components right now, just for the logistics of it. Three committees in the House have already passed a form of this bill with a public option in it. That means that at any given time, this bill could be brought to the floor. They could meet in the Rules Committee, and they have not shown any reluctance to bring it up without having time to digest it or to think about it or to get information out, so they could bring it up as quickly as they want to. Right now, we know that 60 of the liberal members of the majority party have signed a letter saying that they would not vote for a bill that did not contain a public option. 23 members of the Democratic Party have signed or made statements or given some indication that they would not vote for a public option. You would need 38 Democrats to be able to stop this bill, because we're one short in the House right now, down to 434. So you're looking at 217 to be able to stop it. I would suggest to you that the so-called Blue Dog Democrats, you can't put a lot of stock in them in terms of what they say in trying to stop it, because I can't think of a situation that we've had since the Democrats have come back in control where the Blue Dogs have actually held when the pressure really came. In fact, the most vocal of them, as many of you know, was Mike Ross. Mike Ross is a friend of mine. He's a nice guy. He was talking about how horrible this bill was. They just had to stop it. They put so much pressure on him, he eventually voted for it to come out of the Commerce Committee and get out of there. And so I would suggest that if they get to the floor and they twist the arms, they'll have the votes, if they want to, in the House to probably try to get it out. Senate, a little bit different story. Finance Committee, probably the only likelihood of a bipartisan bill. I think that likelihood is very small, but we don't know where they're going at this particular point in time. I think it's less likely, at least as the ball is moving down now, that we'll see a public option component in their first swipe at that, but we don't know. President will come in tomorrow night, try to change this dynamic. We don't know what he's going to say, but your guess is as good as mine. What I think they will do is what they have tended to do in the past, which is to talk one thing and do something totally different over here. So if you look at what they talk about when it's health care, they list all the things that Donna talked about. I mean, you know, the things that all of us could put a bill on the floor, 90% of us in this room would support it, maybe 100% it would pass like that. That's what they talk about. But what they really push, and that's what you were talking about a little bit, it's a control issue. And it's more than just control, it's feeding the constituency groups that help get them in office, which is, I think, more about what they're doing. So that's kind of the lay of the land of what we're looking at from a logistical point of view. Second thing, though, is just some of the things that John touched on a little bit. I think we need to keep in mind, too. It's really been an interesting dynamic. I had a healthcare forum, one of the ones that I was at not too, maybe a couple of weeks ago, had a 63-year-old man in there. He kind of captured, I think, the feeling of a lot of people. He was incensed because the President of the United States would call him a liar, which is basically what they said to the AFL-CIO over the weekend, that if you disagreed with them, the people that were disagreeing were lying about, you know, this situation. One, he was incensed that he'd be called a liar. And secondly, that he was some kind of political extremist because he happened to disagree with this health care reform bill. And the truth of the matter is that this is one of those bills that the more you see, the more you dislike, if you really look at the facts. Because, as Donna was kind of alluding to, the facts are the facts. And, you know, when you start painting the economic impact of this bill, that Donna was kind to them and did not give some of the real painful stuff. But, I mean, the reality is, you're looking at about $800 billion in just, you know, the proposals we've seen floating in new taxes. Most of those taxes on small and medium-sized businesses. 61% of those small businesses, by almost anybody's figures, even if they pay current insurance premiums for their employees, will be hit with a surtax. And by the economic advisor to the White House, his suggestion is that this will be about a 5.5 million job loser, on doing this. And then if you take the Congressional Budget Office, you don't have to take Donna's group, you don't have to take John or me or anybody else, take the Congressional Budget Office, and they have said that what they talk about, lowering health care, will not happen. It is going to increase health care because we are increasing the wedges. And one of the wedges Don didn't even talk about is just the paperwork wedge. I mean, in Virginia, right now, for every hour of health care that's delivered, there's an hour of paperwork that has to be done for that health care. Makes no sense at all. This is the party that kind of brings you that, and there will be more. So I think that the facts of this are overwhelmingly against this bill. The second thing is, another myth that we hear out there is over and over again we hear people saying, well, there aren't any other proposals out there. All you are talking about is no. And nothing could be further from the truth. The number one thing, if we had that old Family Feud television program, you said, survey says, number one thing from the people who deliver health care is tort reform. I mean, it has always been that way. It will always be. Why? Because the trial lawyers are so controlling of the Democratic Party. You're never going to see that come to fruition. But if you talk to every doctor, every hospital, almost everybody who does an independent analysis, they will say that the place you could go tomorrow to get results would be tort reform, and they won't even touch that. And one of the interesting things in watching how they stay away from it is, imagine if we just looked at a system that took tort reform and took the money we spend in litigation and shifted it to prevention in healthcare, how that would skew the whole healthcare curve and what that would do. But some great things we have. Everybody agrees we want individual ownership of policies where you can have the portability of carrying those from one place to the other. 90% of people, maybe 100% would vote for that if it came to the floor tomorrow. Health savings accounts, again, it's a control issue. It just makes every economic sense in the world to do that because, again, it puts the patient in a situation where they're doing shopping, where right now they won't do shopping. One of the best examples I've heard, and it wasn't mine, it was either Newt or Romney, I forgot which, I was having lunch with them, and they said they probably said it in a speech somewhere before, but we were talking, but they gave a great example that I thought was good. Imagine if you were to go down to a car dealership to buy a car, and you simply walked on the lot and said, I want to buy a car. And the salesman came to you and said, John, here's the best car I've got on the lot. Just take it, just drive it home, no cost, you just drive it home. You drive it home, and then later on in the day, you start getting bills that come in that you don't have to pay, of course, but a bill from the guy who put the steering wheel in, and a bill from the guy who put the seat in, and a guy who put the tires on, and a guy who bought the leather for the seats. And all these bills start flowing in, but you don't worry about them, you just put them in a bag somewhere because you don't have to pay them. Which is going to be the cheaper to produce? A car like that, or one where you have to walk in the lot and say, how much is this car? How much is this car? And you're making some choice in the purchase of the car. And we have taken door number one for health care, and that's why it has risen through the roof. Health savings accounts make sense. Purchasing insurance across state lines. I mean, it just seems like a no-brainer. It would get costs down. It's a way of getting portability. The other thing, of course, many of us have advocated for years is the tort reform. We've even talked about if you wanted to have situations to get some people who can't afford it, have some sort of refundable tax credit that you could get them that would help them buy private insurance right now. So there's a plethora of opportunities out there in the health care reform debate. None of those are getting airtime because they want to hold out for the government option, which is all about control, of course, and that's what they want to do.